I always knew I wanted to be a physician from my earliest memory, and I became interested in midlife women's health based on a convergence of a lot of medical interest, gynecology, hormones, osteoporosis, and looking at how different disciplines overlap and how it's such a key time in a woman's life. I see primarily midlife women dealing with menopause, hormone issues, osteoporosis. We also have an innovative medical therapy program for urinary leakage. We take care of women who are breast cancer survivors, who have different problems that cross different disciplines. The first visit is generally a history, sometimes a physical, sometimes not if it doesn't need to be done. And then an individual plan is put together. And then most of my patients follow up with me in general in about 3 months. It's very important for patients to periodically check in because there are new advances, there are new options, and even if someone feels well and is doing well, there may be some tweaks to their system, some new preventive offerings. At midlife, I think it's such a critical time period because many women may be losing their hormones, may be dealing with aging parents and also their own children, new work demands, and this is the time where a lot of chronic illnesses may begin. It's still very important to see a woman's health physician. And for women who have untreated menopausal symptoms, and there's so many treatments, both hormonal and non-hormonal, we have so many options for women now compared to what we just had 10, 20, 30 years ago. It's really incredible. We can really optimize people's health, emphasize prevention, emphasize a functional approach to their health. And to do this at a key time, I think, is very important and helps reduce several chronic diseases, whether it's heart disease, diabetes, osteoporosis, joint disease, and aging memory. We're moving towards, very individualized medical care and looking at the whole person and optimizing their longevity as well as their quality of their life. I have a very active, busy life. I have 3 sons, and I love physical activity and golfing and shooting and traveling and reading and being involved in my community.